From the opinion pages of the Wall Street Journal, this is Potomac Watch.
The Centers for Disease Control and Prevention fesses up to mistakes during the COVID-19 pandemic. But what does its director have in mind for reforms? Welcome, I'm Kyle Peterson with the Wall Street Journal. We're joined today by my colleagues, columnists Alicia Finley and Kim Strassel. Happy Friday to you both. Rochelle Walensky, the director of the CDC, acknowledged the agency's mistakes in a video sent to its staff of about 11,000 people this week. Here's part of what she said, quote, "To be frank, we are responsible for some pretty dramatic, pretty public mistakes from testing to data to communications," unquote. And earlier this year, she ordered a review of the CDC's performance. Reportedly, she's received those findings, though they've not been publicly released yet. And let's listen to a clip of the omnipresent Dr. Anthony Fauci on the CDC's changes. And this is him speaking on MSNBC.
I think they should be commended in the fact, particularly Dr. Walensky, realizing and recognizing the shortcomings that have been there for quite a long time, long antedating Dr. Walensky's tenure. And I think it was the stress and the challenge of a historic pandemic that brought some of those deficiencies into sharp relief.
Alicia, what is Dr. Walensky saying that she wants to do to fix the CDC? And do you think that some of those changes might be a step in the right direction?
Well, it's actually quite nebulous. She really isn't providing many details. She's released a one-pager on the website Wednesday that said that she wanted to put more emphasis on, quote unquote, action and equity, along with improved public communications, increased diversity, improve worker training. But she hasn't actually provided many concrete details here. So it would appear that she means by action, making more action-oriented, would be responding quicker and more effectively to the pandemic. The agency was really caught flat-footed repeatedly by the surges at the beginning of the pandemic, the emergence of the virus itself, kind of flying blind, in part because of its own testing goofs. If you recall, the CDC actually took the lead in developing the COVID test in January 2020. In February 2020, and it limited private labs, which aren't actually FDA regulated and can actually develop their own tests. It really tried to hamstring those when it botched its own tests, contaminated the materials. Walensky doesn't address this, the CDC, or its perennial failures at its own labs, which I think that Fauci was alluding to. If you recall, back in 2014, dozens of employees at a high-security CDC lab were exposed to anthrax because the employees didn't follow the proper procedures and didn't sterilize equipment. And in another case, a few weeks later, the employees had somehow contaminated or mixed samples of a very dangerous flu strain accidentally and wasn't discovered until 6 weeks later by the Department of Agriculture. And nothing happened to these employees. And that's essentially one of the problems with the CDC is that there is no public accountability, that people aren't fired. And when they make a mistake, the CDC merely asks for more money and says, well, we can fix this if Congress gives us more money. And that is essentially what Dr. Walensky is saying now. Give us more money, Congress, and we will restructure the agency somehow, and we will do a better job next time.
But just to start reviewing some of those COVID pandemic blunders, I mean, the testing one is the one that probably sticks out in people's minds. And just to underline what Alicia said, part of the problem there was not only that the CDC kind of botched its official version of the first COVID test, but also there were these other clinical labs, academic labs, that were saying that they were perfectly capable of designing and doing their own COVID tests. And remember, this was back when there were no COVID tests, right at the very beginning when the virus arrived, and they were not allowed to do that, essentially. And I take Alicia's point that seems like that should be a huge lesson here, and maybe one that Walensky is not fessing up to, that the CDC maybe should relax a little bit of its control over these things. We're not talking about people in garages who are selling COVID tests out of the back of a van. We're talking about really highly credentialed scientists at academic labs and so forth who were not allowed to provide the COVID testing that they were capable of doing.
Yeah, I mean, one of the problems with this review and then this nebulous "will do better" promise from Walensky is that if you're not going to identify what's really gone wrong, you don't really have any chance of fixing it. And if you step back and you look at the CDC, I think any reasonable observer can figure out some of the problems. One of them, as Kyle, you, and Alicia were just talking about, is this interest that the agency has in its sort of own innovation and its power and authority over putting that over, in fact, getting the job done. Look, the core responsibility of the CDC is to track diseases, collect data, share that data so that people know what's going on, and deploy resources out to help local public health authorities. And one of its big problems has just been misdirection. It's all over the place, particularly been tromping into social and environmental issues. There was a study in May all about how gun violence among Black men was the result of structural racism, and the answer to all of this ought to be more transfer payments to them. I mean, what does this have to do with infectious diseases? The other problem the agency has is politics, which has infected so much of what it does and which gets in the way of that core mission. So a good example of this is it decided not to collect info on disease breakthroughs that we were seeing in COVID because, oops, that might undermine the major vaccine campaign they had going on at the while. Or, as everyone now knows, why were school teachers' unions involved in any way in directing the guidance for school reopenings? So these are some of the things that stand out as glaring problems at the CDC, yet none of this was addressed by Walensky, either in her admissions or what she claims she's now going to do to fix the agency.
The politics issue is a good one, too. And Alicia, there was also this controversy of the CDC and the Department of Health and Human Services under President Trump kind of jockeying over who was going to control some of this COVID data. Remind people what the story there was and who was right in that situation, because that's still kind of disputed, it seems to me, about whether that was a matter of HHS playing politics or the CDC playing politics, or maybe a little bit of both.
So backtrack a couple of years ago. Now the CDC posts data on hospitalizations by states, age groups, along with some other information on vaccines and now vaccine breakthrough infections. Does not post the raw data, unfortunately. So outside scientists can't actually analyze the information in itself. But it does provide some information that is helpful and provides kind of a very broad overview of where cases, death rates, and such. But at the time, back in June and May 2020, CDC had very little information and there was very little, and nor did state officials or hospitals. Just wasn't collecting the information, didn't have technical systems. Hospitals were essentially faxing the information. I mean, who uses a fax nowadays? To the CDC, which really limited the insight that the CDC, HHS, and others had, especially when they're trying to deploy resources. At the time, recall, there was an effort by the Trump administration to provide surge teams to particular states or regions that needed the extra help. But CDC was not collecting this information, so the Trump administration did not know where to surge those resources. So summer, June 2020, it basically just said, get out of the way, CDC. We're going to bypass you. We're going to set up our own central repository for hospitals and states to send information. We're going to set up our own system. And there was a big backlash on the left when it did this. It was said that the Trump administration was undermining the CDC, the scientists at the CDC, and was going to make this information less transparent. That didn't end up being the case. It actually ended up making the information more transparent. And the CDC eventually did hand back the information and control over to the CDC as it was able to set up its own systems. But it was very slow doing this. And one of the problems, of course, is, to Kim's earlier point, is this is one of the fundamental missions and responsibilities of the CDC is merely to track these cases and to collect information and data. We've seen this with the monkeypox too lately, but also, during the pandemic, it became abundantly apparent that they just weren't doing this. And it's very difficult to respond to a public health emergency or a pandemic when you don't even know the scale or scope where cases are occurring. And so now we're starting to see, the CDC has improved on that. But again, The monkeypox is another illustration of where it has continually fallen short.
The other example where politics, I think, comes and plays into it, Kim, is the CDC's nationwide eviction ban. And again, don't forget, people probably remember that eviction ban and that it was eventually struck down by the Supreme Court, but they might forget that that was issued under the auspices of the Centers for Disease Control. And Kim, there it seemed explicitly like politics was coming into it, because when it was going to expire, that it was renewed, and all of the pressure was on President Biden to make sure that it got renewed. And he seemed to take credit for doing that in a press conference. And so it seemed like that was a policy that was directed from the White House. And I know people have their criticisms of independent agencies, but there's a reason that defenders of those think they should be set up that way, because it seems to me that President Biden didn't do any help to the CDC's credibility by forcing it essentially to try to enact this nationwide eviction policy that was pretty clearly unconstitutional.
Yeah. I'm old enough to remember the last administration and all of the claims that politics was corrupting science, and the Joe Biden campaign promising that if elected, he would make sure all of that would come to an end. Of course, that hasn't happened, and that's been part of the frustration with the CDC. The eviction moratorium is a really good example of it, because it did seem to be coming from the White House. It looked as though it was big-footing people on the ground, the public health officials who are supposed to be making a qualified judgment on this based on the science, especially because the CDC was out there spouting all this nonsense in order to justify this. Somehow this eviction moratorium reduced the virus's spread. There was absolutely never any evidence for that. And you've seen this in other areas too. It's why you've seen a growing failure of trust in the agency, because there's a lot of suspicion out there that some of the decisions that have come out, particularly in the past a year and a half under the Biden administration, are ones that are highly politicized, because you had a president walking around lecturing people about how their behavior was supposed to be under COVID, for instance, wear a mask. And then you end up having the CDC, which has a lot of data that it doesn't publish. And in partly because it seemed as though the CDC was more interested in keeping that data to itself and then publishing its own studies about the data in order to push a certain narrative or back up a certain policy, for instance, mask guidance. And it's, again, really caused a lot of Americans to just tune out the CDC, not really pay any attention to this guidance, especially as well, because so much of the guidance was coming months after everyone else had figured this out in one way, shape, or form, in particular at the state level, where public health officials were very much ahead of the ball game and sort of forging the way in what was clearly becoming a different environment in COVID.